Health promotion in the workplace, a settings approach. Health promotion has become an international practice since the Ottawa Charter in 1986, with the World Health Organization identifying many processes and principles to tackle many of the world's health problems. Health promotion is a process that enables people to increase control over their health in order to improve it. Many countries have become much more focused on improving health since the introduction of the Ottawa Charter, and although there has been improvement, there is definitely room for change. Although there has been an increase in life expectancy since 1990, there has been a more rapid increase in years lived with a disability due to non-communicable diseases such as obesity, chronic obstructive pulmonary disease, and diabetes. This outlines the need for fundamental change in key aspects of life, such as diet, exercise, cigarette smoking, and pollution. Another key health issue, even in developed countries, that we need to be aware of is drug-resistant strains of disease such as malaria. This presentation seeks to explore the settings approach to health promotion, with a particular emphasis on tackling some underlying issues of non-communicable diseases in the workplace. We will look at examples of workplaces that have incorporated health programs into work life and their effectiveness. We'll then move on to explore some of the challenges and opportunities that health promotion practitioners face when dealing with settings-based health programs. So what is the settings approach to health promotion? The settings approach to health promotion really began to emerge after the first International Conference on Health Promotion, the Ottawa Charter, in 1986. During this conference, it was stated that health is lived in everyday life and created where people learn, work, play, and love. This gave the idea that health promotion programs should be implemented into everyday places such as schools, hospitals, prisons, workplaces, and even on larger scales such as cities. The settings approach to health promotion gives a place, such as a workplace, and a population, such as employees, to implement health programs, making it easier to influence hard-to-reach populations. It is thought that health behaviors are easier to change when focusing on a setting rather than an individual. This multidisciplinary approach links in with the key principles of health promotion proposed by the World Health Organization, especially creating supportive environments. The aim of the settings approach in the workplace is to change the whole culture of workplaces to make health behaviors a priority, create company policies to support and encourage healthy lifestyle changes, increase worker productivity, and decrease workplace injuries and sick leave. There are many examples of health promotion programs being implemented through a settings approach. One example is the Get Healthy at Work program. Get Healthy at Work is a program initiated statewide by the New South Wales Government in 2014. This program aims to improve the health of working adults by giving workplaces support and resources for their own corporate interventions. Get Healthy at Work aims to tackle healthy eating, healthy weight, physical activity, active travel, cigarette smoking, and harmful alcohol consumption. Workplaces must register to participate in the program, and there are 5 basic steps to the program. 1. Leadership commitment and involvement of workers. This means that employers and leading employees showing initiative and encouraging fellow workers to be part of a healthy lifestyle change. 2. Establishing the needs of the workplace through online health assessments or through a face-to-face meeting with a registered nurse. This is done on an individual basis. Prioritizing a health issue and developing a plan. Workplaces are able to choose specific goals and develop a course of action on how to achieve them. Implementation of the plan. Implementation can be done on both an individual and workplace level. 5. Monitoring the progress of the goals and adjusting the plan as necessary. Evaluating the effectiveness of the program is important and is usually done through a questionnaire. The workplace leaders were to choose one aspect of health to focus on and create a plan for it. The brief health check service was incorporated into the Get Healthy at Work program to help assess workers' health and their risk of heart disease and diabetes. The brief health check is a free confidential service that can be either completed online or face-to-face. This health check offers referrals to various services such as the Quitline, health coaching services, and general practitioners. This program requires commitment and initiative from company leaders to initiate and encourage other employees. An evaluative study of the Get Healthy at Work program, conducted by Canal et al., found that the program reached a wide range of populations. It was also found that the implementation and progress of the program in many workplaces was slow, which may be due to a variety of reasons. Some users suggested that the Get Healthy at Work website, which the whole program is essentially based off, was difficult to navigate and may have contributed to the slow progression of the program. Another key issue with this program was the underestimation of the amount of time, commitment, and resources required to effectively implement and sustain the program by workplace leaders. The report also revealed that medium to small-sized companies were more likely to uptake healthy lifestyle changes suggested by the brief health check than as compared to larger businesses. This may be due to the larger amount of interdependence in small businesses. Although this program reaches important populations such as those at high risk of type 2 diabetes, there are many issues that need to be addressed to increase the effectiveness and ease of use of the program. This video gives a brief overview of the program and some examples of how workplaces have implemented it.
For senior managers, the Get Healthy at Work program is really designed to provide the resources and processes to implement a really easy and effective workplace health promotion program.
We've become more focused on the well-being of our people as our business has changed, and the demands on modern businesses have grown.
I felt that our people needed to be involved in this sort of initiative. When you look around, a lot of us don't fit the healthy category, so I really wanted to support the program for the site.
We were contacted by New South Wales Health. We were looking at doing a wellbeing program, and it was just a great coincidence that we could do this pilot with them.
The Get Healthy at Work program is a real opportunity for workplaces to make an investment in their biggest asset, their staff. We have a brief health check component, and that's an individual assessment of workers which can be done online or face-to-face.
The New South Wales Health guys really worked hard with us on understanding that they came with the right number of people to get through people quickly.
So we were able to manage it on-site effectively, get people to sessions without actually stopping plant. Then the follow-up to that, identified some issues around, in particular, the provision of cold water, and we've sorted through that.
Looking at the level of risk in the business, say in relation to healthy eating or the prevalence of smoking, that would be prioritised.
We got a report back with key recommendations from the results, and then we drafted an action plan in consultation with what they already had with the management committee to actually advise or recommend some small changes that they could adopt that might make a difference to support their workers.
We've seen certainly a significant improvement in the hydration levels of people, and certainly seen the presence of fruit and those sorts of things in lunchrooms and that sort of stuff rise. And I guess the other part is just the conversations are certainly more and more around hydration, healthy eating, exercise.
Well, one measure can be shown through our staff retention rate, which was hovering around 60% about 3 years ago, and it's now increased to 85 to 90%.
It's been really, really successful because, of course, the minute you start taking a genuine interest and a sincere interest in your people, they start to take a more sincere interest in you.
Well, the first step is to go online and look at the Get Healthy at Work program. Then simply sign up your business.
There have also been an increase in settings-based health promotion programs in schools, prisons, and cities around Australia. Many of these settings-based programs attempt to tackle the issue on various levels, including the incorporation of policy change and environmental implementation. As with any area of health promotion, there are many challenges and issues that practitioners face. It has been identified by the World Health Organization that non-communicable diseases are the leading cause of death in the world. Health programs have been focusing on tackling the underlying risk factors associated with non-communicable diseases in order to improve general health and reduce the prevalence of such diseases. Many health programs focus on healthy eating, physical exercise, cigarette smoking, and drug and alcohol use, such as the Get Healthy at Work program. Individual physical limitations is one of the many challenging factors that health promotion practitioners face on a regular basis. People come from all walks of life and have different fitness and ability levels. It is difficult to incorporate various exercise and fitness resources and tools to cater for all people while still preventing injury. Similarly, all people have different intrinsic and extrinsic motivational elements to encourage and maintain a healthy lifestyle. Given that today's society is very monetary driven, compliance to health promotions may be difficult, particularly if the programs cost considerable amounts of money and time. This may have also linked to the low participation of workplaces in the Get Healthy at Work program due to the amount of money and time that it actually takes to put into the program. Perhaps health programs in the workforce could be advertised more as an investment for long-term gain, such as reduction of sick leave and increase in productivity. Motivational issues are particularly challenging when attempting to reduce cigarette smoking, as cigarette smoking is highly addictive. As health programs in the workplace involve multiple disciplines, another challenge for health promoters is being able to assess the effectiveness on each program in order to discover and improve any flaws. Because workplace health programs are multifaceted, there is currently no clear framework or method for this type of assessment, suggesting that this needs to be an area for further study. Other studies have revealed that key components that affect health promotion effectiveness in the workplace include study population, intervention contexts, and methodological quality. One of the great aspects of the settings approach to health promotion is its ability to access difficult-to-reach populations. A study conducted in 2013 revealed that a school-based health program was able to reach minority groups that would not have likely been reached otherwise. Similar has been found in workplace health promotion programs. Employment of health programs in the workplace particularly allows for access to large portions of the adult population to be covered that may not necessarily be reached through other means of health promotion. By incorporating such programs into everyday life, this encourages health behavior on a daily basis rather than on the off occasion. This has the potential to promote health behaviours into habitual behaviours, leading to long-term healthy lifestyle changes. Healthy lifestyle changes taken from the workplace also have the potential to be carried on in homes, encouraging the reduction of intergenerational lifestyle disease such as obesity and diabetes. Another positive aspect of health promotion in the workplace is the limited resources required to advertise such programs for implementation. Even in large companies, communication between employees is a must for effective productivity. The rise in the use of smart technology also assists the process of advertisement, thus making implementation easier across wide populations. Workplace health promotion programs have great potential in health promotion and should continue into the future. They encourage wide populations of all demographics with healthy lifestyle change options that can prevent the high death and disability rates produced from non-communicable diseases. There needs to be more research into identifying factors that increase and decrease workplace health program effectiveness, whether that be variations in populations or focusing on specific healthy lifestyle changes. Particular health issues that relate to particular populations and demographics, as the current research suggests that some health programs may not be effective in all populations. Some further research is required to formulate easily understood and implementable frameworks in order to increase participation. Do we need different frameworks for different populations or industries? Researching and developing effective and efficient evaluative tools to assess settings-based health programs due to their high complexity. This is very important. How do we know that the health programs are working and what needs improving? Although it was suggested in the Get Healthy at Work program that there may have been a correlation between the program and employee retention, without experimental designs, appropriate assessment tools, how do we know the direct effects of the health programs? The world is ever changing and so are key health issues, so new frameworks and assessment tools for health programs need to be developed every day.